Welcome to the Bougie Baldie podcast with your host, Kellie Rhymes.
Society promotes beautiful long hair. They promote that as beauty. And because society promotes that as beauty, many women out here feel like if they don't have this long, beautiful hair, they're ugly. And that is far from the truth. Oh, I see you cut your hair. And I'm like, yeah. But then she's like, but don't you want to just leave a little bit of hair? Once again, did you ask me what was going on, why I cut my hair? And so out of respect, because she was an older lady, in my mind, I wanted to say, do you know me like that? Like, you don't know me like that, right? Yeah.
I just feel like we have reached a pinnacle in society where there is a lack of respect for people that are different than you. Yeah. And I think it becomes a broader conversation that we need to have because everybody is different and we all have the right to be different.
Yes. A lot of times when people approach us in a negative manner, it's because of a character defect or flaw that they have in their personality.
I think that us, along with the rest of the community, that we have some work to do because a lot of the questions and approaches that we get from folks who are not in the community is, I think, out of ignorance. And as baldies, I think we have the responsibility to start to educate and reach out more so that people can be aware and understand what's acceptable and what's not acceptable.
So I just left the office like, look, guess I'll just be wearing this wig. Didn't even know how to buy a wig at first. Looking a hot mess. Went to the beauty supply with my 60-some-year-old cousin, and she wore a wig, and I'm like, I need help. And she's like, okay. And we just trying to pick something out. It was a hot mess.
Yes, you don't think that bald women look good in a gown? Well, let me show you. Yes, we do. And we can still get glammed up, and we still look classy, and we still look beautiful.
But it was still very emotional when I first lost my hair and having to touch my head and see it in my hand and was just like, okay, this is very real.
She took my hand. She took my face on her hands and he said, honey, you are beautiful, but you really need to corner here. She said, I suggest you find a wig that you like and go from there. And I left her office bawling, but I also felt so good because for the first time someone told me something that actually made sense to me.
Right now, I could grow my hair back out, but I love the bald, so I don't. So I still feel those questions of, so when are you gonna grow your hair back up? Are you growing your hair back out? No, I'm not, because like Denisha said, I was born to be bald.
Hey, welcome back to another episode of the Bougie Baldie podcast. I am Kellie, Miss Kellie Michelle. You may know me on social media, you may not, but if you don't, I'm Kellie Rhymes. I'm a women's hair loss support and authenticity coach, and now I can add TV producer to my title. I'll talk about the show later on in the podcast. But today, I have a wonderful guest, another wonderful guest. We actually met at the Scarring Alopecia Foundation Conference. So Dr. Mina Singh has been featured on TLC's Bad Hair Day, and she's a board-certified dermatologist and derm surgeon. She attended Harvard Medical School, trained at the Mayo Clinic, and completed a procedural fellowship with the International Society of Hair Restoration Surgery. Dr. Singh is the medical director of the Skin and Hair Center. She maintains special expertise in hair transplants, medical therapy for all forms of hair loss, and treating ethnic skin. She has lectured at numerous international surgical conferences. Welcome again to the Bougie Baldie Show.
Thank you. Thanks so much for having me.
Oh,
nice
no.
to see you again.
Yes, I wanted to get a dermatologist on here.
Yes.
Specializes in hair loss because I learned at the conference, like there's a difference between just a regular dermatologist that specializes in skin and one who has specialization in hair, the scalp, the hair loss, and all of those things.
Yes. I will say, part of dermatology training, we're trained in everything skin, hair, and nails. It's just with everything in medicine, how much time you spend seeing certain things. So, for example, with dermatology, again, we're trained in all procedures really that affect the skin, but you probably don't want me doing your liposuction because I have not done it in a very long time. You want someone that does it all the time, right?
Right.
So that's just the difference. Like people, I'm one of those people that just does it all the time.
Okay. Okay.
Yes.
Cool. Now, you are based in Kansas City, Kansas,
Right.
correct?
Yes, on the
All right.
campus.
Now, are
Yep,
you originally from Kansas City,
I
Kansas, or?
am. Yeah. I did
Okay.
all my training elsewhere and then I came right back home.
Okay. Oh, so I'm from St. Louis, Missouri. So, let's just
Beautiful.
skip
Yeah.
away.
Right down I-70.
Yes, yes, yes.
Mhm.
All right. So you have expertise in hair restoration and dermatology.
Yes.
Now, I remember you talking about your, I think, was it your mother who was in the medical field as
Yes.
well?
Yes. She
Okay.
was one of the first Black women to graduate from her medical school,
Okay.
and I wanted to be just like her.
Okay. Okay. So that's what led you into this field of work. Now,
Absolutely. Yes.
what made you want to specialize in the dermatology area and the hair loss treatments?
Okay, so dermatology, just so we're honest here, is not something I was interested in whatsoever. I wanted to be the orthopedic surgeon for the Kansas City Chiefs. That was my dream.
Okay.
And somehow dermatology kind of fell in my lap due to research. I had written up research in dermatology, just fell in my lap. And I was kind of coaxed into developing an interest in dermatology, which is unusual because it's such a competitive field of medicine. It is so hard to get into, and it's unusual for someone to say, "Hey, you should try this," instead of me begging to get into it. And so it did fall in my lap in a way that I was prepared for it, but it was, destiny, universe, fate, the stars, whatever. Once I
Mhm.
did decide, I did not know what dermatology was, and I honestly wasn't familiar with how much people of African descent really needed more dermatologists. So it was a lack, it was ignorance on my part. I didn't know much about it originally in medical school. Anyway,
Mhm.
when I decided to do it, I realized that there's so few Black dermatologists. Like we were less than 2% at the time. And
Mhm.
that, you could, with the Chiefs, right, you can fix a bone the same way. It does not matter what the person looks like, here. With dermatology, it's the exact opposite, right? What a person looks like, their melanin content, how we scar, how we pigment really determines our diagnosis or misdiagnosis. It determines how we treat. And some of the procedures that we do, we can actually disfigure someone if we don't know the appropriate treatments based on skin color, skin content. So once I got into residency, there was a really big study done by Dr. Susan Taylor, and it just looked at the reasons why people of African descent sought out dermatologic care. And one of the top reasons was hair loss, which was really fascinating because every other demographic, it was skin cancer, acne,
Mhm.
warts, eczema. But with people of African descent, one of the top reasons was hair loss. So I figured, again, let's go back to my mom. She was one of the main reasons that I became a physician in the first place. I wanted to be like her and be a community physician, and my community are people that look like me. So I said, I
Mhm.
figured I should probably figure out how to treat hair loss so that when I go into my community, I can serve them adequately. Long
Yeah.
story short, sorry. Longest story ever.
And we appreciate it because I have spoken to so many women, I'm sure you heard this as well, who have hair loss and they struggle with finding a dermatologist that can help them or give them the right treatment plan or even just give them honest information, really.
Correct. Yeah.
I
Hmm.
know there is one young lady I spoke to who said she had went to so many different doctors until one, she found a Black dermatologist who
Yes.
sat down and said, "Look, your hair is not coming back. I have to just tell you honestly." And that's what she needed to hear.
Mhm.
That's what she had been searching and searching and searching, and she just needed to know the truth and just to say, "Okay, this is what it is." All right.
Yeah, and honestly, to that point, because of hair loss is an epidemic amongst Black women in particular. I have colleagues who are interested in so many other things in medicine, but because they are Black dermatologists, people seek us out just as their physician or their care provider. And
Right.
so, while they started their careers not really that interested in hair loss, now they're experts in hair loss because they had to because of that
Hmm.
need.
Hmm.
Mhm.
Definitely. I
And
just know, like, my experience going to the dermatologist for the first time about my hair loss. And it was a Black dermatologist,
Mhm.
but I don't know. He didn't offer me any solutions, any information. He just looked at
Yeah,
me and was like, "Oh, you have scarring alopecia,
yes.
and there's nothing much you can do about it." And that was it. And I
But
left.
I will say, oh, go ahead, please.
Oh no, no, I was just saying I not left just like, okay, well, this is what the doctor says, so okay.
I will
But
say,
now I kind of know. Go ahead.
well, thanks to many of my colleagues who are doing amazing research. When I was in training, which was 2000, how old am I? 2008, no, 2009 to 2011. So about 15 years ago,
Hmm.
that was the answer. If you had
Yeah.
scarring alopecia, you got maybe steroid injections, and if it didn't grow back because of steroid injections, that's what you got. We didn't even start applying minoxidil to the scalp of patients with scarring alopecia until later than that. And when I trained at Mayo Clinic, like you stated, which is, a major dermatologic department, and I had to do an outside rotation, a skin of color rotation, just to learn how to treat patients that look like me. So,
Hmm.
you know, this is the reason. And now, and I will say also, those of us that are really interested in hair, we are advancing every year. The things that I'm doing now, I was not doing last year.
Okay.
So, it's really, really hard for my scarring alopecia patients because if you had seen me 15 years ago, I probably would have said the same thing. Hey, let's try some
Hmm.
steroid injections. Doesn't grow, doesn't grow. I'm so sorry. Uh, I am like well past that now. There's so many things that I'm doing now that I wasn't even on the radar even 5 years ago.
Hmm.
Like oral minoxidil. I wasn't doing that 5 years ago. That's newer.
Okay.
I've just been doing the last couple years. So all these things, it's a quickly, rapidly evolving field in a good way. But
Hmm.
I if you had seen any of us 15 years ago, we would have said all the same thing. Like, sorry, it's scarred over. There's nothing we
Yeah.
can.
And it was probably about that amount of time, or probably a little bit longer.
And unfortunately, as you know, early detection is the key, right? So
Yes.
if we can catch it when it first starts happening, that's why our collaborations with our stylists locally and, as much as we can, if someone can catch it early, it's a lot easier to prevent further hair loss than it is to grow hair loss back once it's gone. So we know all these things now, of course, but
Hmm.
it's now. So no,
Now,
no
right.
time machine to go backwards, unfortunately.
Right, of course, of course. So,
Yes.
okay, your clinic is the Skin and Hair Center,
Yes.
and it has gained a reputation for innovative solutions in hair restoration.
Mhm,
So,
mhm.
what unique approaches or technologies do you incorporate to set your clinic apart from others in the industry?
Okay, so I, just like you stated in my bio, I lecture a lot internationally, which means I'm exposed to some of the top hair restoration surgeons and hair loss physicians in the world. And we do a fantastic job collaborating, but every time I go to a meeting, I'm taking something back that they're doing maybe in other countries that we haven't started doing here or
Mhm.
that very few do here. And so even with something like platelet-rich plasma, I introduced that to my patients very, very early on when very few people in the States were doing it. So I would say what sets me apart are my bio-regenerative therapies. We're doing a treatment now that comes from Italy. There's only a handful of us in the States that even have that right now. And
Mhm.
just things like that. I've only had that device for a year, but we've done hundreds of patients now and seen great results. That just things like that. My bioregenerative therapies are really, I think, what sets me apart because I try to stay advanced as possible. And I should say though, I try to only incorporate bioregenerative therapies that have some evidence behind it and that
Okay.
makes sense. And that I would not introduce it to a patient if I did not know that it could show results because
Mhm.
all of these things are unfortunately out of pocket. These are not covered by insurance whatsoever.
Yeah.
So I would not introduce it to my patients unless I felt that it would help and improve. So yeah, so I do like, and again, things that I'm doing now, uh, there are bioregenerative therapies like that new device from Italy. There's a technique called medical microperfusion that has become more and more popular out of Brazil and Spain. And I just started doing that this year. So I do want to give a shout out to my very close colleague, Dr. Achama Ose Tutu. Her and I have an organization together called Docs for Hair,
Okay.
DOCS for Hair. It's a hair loss directory that helps patients find hair loss physicians in the country and also internationally. But her
Mhm.
and I have started doing a workshop where we teach other physicians how to do these bioregenerative surgeries, or excuse me, procedures, as well as hair transplant surgeries on patients with Afro-textured hair. And I would say her and I collaborate a lot with these bioregenerative therapies, and I've used a lot of her experience in my own clinic as well.
So, okay, so for everybody out there who may not know what bioregenerative what is it called? Bio-regenerative.
Bioregenerative therapies. So it's kind of like,
Therapy.
you know how we talked about doing like steroid shots, right?
Okay.
That has been the kind of standard of care for inflammatory hair loss, whether it's alopecia areata, where you can lose all your hair, or scarring alopecia. That's anti-inflammatory. So it's very similar to, we talked about the Chiefs, right? My football
Mm-hmm.
team.
Mm-hmm.
When someone gets injured, let's say someone's shoulder is injured or their knee is injured, you can inject it with a steroid, right? That
Mm-hmm.
does not heal the tissue. You have not fixed it. All it does is reduce the inflammation so it doesn't hurt as bad so they can go out and play. So
Okay.
these bioregenerative therapies happened in these fields, orthopedic surgery, neurosurgery, plastic surgery, where you want to try to heal the tissue and stimulate repair of that tissue instead of
Okay.
just reduce inflammation. So those are bioregenerative, biostimulatory therapies. And someone about 10, 15 years ago was smart enough to say, well, why don't we just use that for hair loss too? So they started implementing these procedures such as platelet-rich plasma, which would have been one of the first ones,
Mm-hmm.
as injections into the scalp
Okay.
to uh, instead of just suppressing inflammation, to stimulate collagen production, stimulate new blood vessel formation, and stimulate the cells that produce the hair to populate better.
So when you're using this method, is
Yes.
like is it for like mostly, I guess I should ask, what type of hair loss do you see that it works the best for? That's the best way for me to ask it.
Okay, what it works the best for is telogen effluvium. Telogen effluvium is a non-scarring hair loss that is simply a problem of hair cycling where your hair is shedding more than it is accustomed to, than you're accustomed to. So you have
Okay.
a greater percentage of hairs that are shedding. It works best for that. But that also, most therapies work best for that because it's just a cycling problem. And once you get your hair to cycle back in better, then
Hmm.
basically the problem is corrected for the most part. Uh, it is hardest to get hair to grow back with scarring alopecias, but we can do it. Just depends on when I meet you, right? If I get it early, higher likelihood to get hair to actually grow back, increase density in the area. If
Hmm.
it's more advanced, sometimes I'm using these bioregenerative therapies mainly to preserve what we have and to
Okay.
reverse some of the thinning areas, but I'm not maybe able to get hair to grow through the scar. Sometimes I am. So, you wouldn't know until you tried it.
Hmm.
But and I would say, interestingly, alopecia areata, that is the condition where you can lose all your hair very quickly.
Right.
Autoimmune alopecia, that type of alopecia actually responds really well to bioregenerative therapies as well. And
Okay.
again, well, depending on when I meet the patient, if they've been bald for 10, 15 years, it's unlikely we get that hair to grow back.
Okay. So
Mhm.
is it a painful procedure? Because I've heard, some people say when they get the injection in the scalp, it hurts. So,
We numb. Okay, anything can be painful, right? So, but we
right.
also numb the patient first. I didn't always numb my patients beforehand because the platelet-rich plasma would be like a 3-minute procedure. So it
Okay.
didn't make sense to spend 8 minutes numbing the patient with injections when they could have just been done with the procedure anyway. But
Hmm.
now I'm doing a lot more, like I said, bioregenerative therapies along with the platelets to make a more consistent response because platelet-rich plasma isn't the most consistent when it comes to response because you're just using a preparation of the patient's own blood, right? It may not respond as well. Anyway,
Hmm.
the point being, so now we numb the patient, and they're mainly comfortable. I don't get a lot of complaints about pain now,
Okay.
yeah,
Now.
but I will say you have to numb the patient. So paradoxically, numbing a patient hurts.
Oh goodness. And you
Yeah.
know what? That was like one of my fears too when
Yes. Mhm.
I was going through my whole journey, even though
Yeah.
I wasn't really offered that. My sister also has hair loss. And so she was getting the injections and she was telling me how painful it was. And I was like, yeah, I'm not doing
Yes, and
that.
I will say we use a lot of techniques now too. We use vibrational anesthesia, we use cold anesthesia, we use like tapping and pressure, and then now, so I mean, everything is evolving. Okay, this is
Mhm.
over time. Sorry, and I apologize to my patients of 2 or 3 years ago, but now I use much smaller needles. You know,
Oh,
I'm using
okay.
like 32, 34 gauge needles, which feel very different from a 30 gauge needle, which,
Okay.
or a 27 gauge needle. Like I used to do my platelet rich plasma with 27 gauge needles. So
Hmm.
again, it's all evolving and we just do what we have. So like I said, everything I do is based on evidence and, a lot of experience. And so I do my best with what I have and what's evolving, right? So I'm not just adopting everything that I hear about. I'm only adopting the things that make sense for my patients.
Okay. Good, good. All right, so let's go to my next question. And your practice, you deal with various different types of hair loss.
Every
Um,
single time. Mhm.
yeah.
Yes.
So, what are some of the most common misconceptions that people have about hair loss, and how do you usually address those?
Okay, the first thing is what is alopecia? So everyone, a lot of people think alopecia is the autoimmune alopecia where you lose all your hair very quickly, very rapidly.
Mm-hmm.
And so they say, well, I don't have alopecia, right? And I'm like, well, if you have hair loss, you have alopecia. You just have a different type of alopecia. So I think the number one myth would be there are numerous different types of alopecia, right? There's telogen effluvium, that's the cycling one that makes your hair shed more. There's androgenetic, that's male, female pattern hair loss. That's in some people would consider it almost a normal variant of aging, but it's not like we like it. There's
Mm-hmm.
alopecia areata, which is the autoimmune form of alopecia. There's traction alopecia, where the hairline recedes due to traumatic hairstyles. There is CCCA, scarring alopecia, centrifugal cicatricial alopecia. There's lichen planopilaris, frontal fibrosing alopecia, discoid lupus. And then there's a type of alopecia just happens with aging. We call it senile or senescent alopecia. That's just your cells stop dividing as rapidly.
Okay.
So again, that's the number one myth, and I took a long time answering that, but it's just there's so many different forms of alopecia. So number one is diagnosis, right? So
Right.
I would say another myth is just to, go internationally, go across seas, and just get a hair transplant.
Mm-hmm.
A lot of people are not a candidate for a hair transplant. You need to see someone first where you live, get a diagnosis, get a workup, have stable form of hair loss before you get a hair transplant. I think, we see a lot of, now it's TikTok. It used to be like the commercials on TV, amazing before
Right.
and afters. These people everyone has a different caliber of hair. Your hair color versus your scalp color matters. What type of hair loss is being treated matters. If you get misdiagnosed or not diagnosed at all and you get a hair transplant, you could lose those grafts and the grafts may not take very well. So these are all things that, are myths where, you can't just, jump into a plane and get a hair transplant without having an evaluation if you want really good outcomes. And you also need to make sure you know who's handling your complications, because we see complications from surgeries overseas all the time. And I live in Kansas, so I shouldn't be seeing that many from overseas. So
Mm-hmm.
small community. So who's managing the complication is not the person doing the surgery, unfortunately, and that's not appropriate. And
Okay.
then other things are basically treatments, right? So there are a lot of anecdotal treatments. You can go online, if you open up your phone and say hair loss, then your whole algorithm is hair loss treatments, right? There are a
Yes.
lot of things, tinctures, oils that can work for certain people, right?
Mm-hmm.
But it needs to be evidence-based so that it works in large groups of people. So I typically only recommend things that have more evidence for it. There are many, many, many things that stimulate the hair cycle, many, many things that stimulate growth and the
Mm-hmm.
growth rate, but they may not necessarily work for the majority of people that use it. It might just work, just because it works for one influencer doesn't mean that it's going to work for everyone. And I also think that we need to be careful who we get medical advice from, because
Right.
just because someone knows how to take care of themselves does not mean they should be giving medical advice to others.
Yes, yes. So I just want to pause for a second
Yes.
because what you said about, well, a couple things.
Hmm.
The hair loss, I mean, hair transplants not
Hmm.
taking,
Yes.
and people like still, our doctors still performing these hair transplants and
Yes.
knowing that it could not. So I am grateful because I remember in my journey, I did go to a hair restoration company to see,
Yes.
one of the popular ones that had the commercials.
Yeah, no, it's okay. That's you have to
And-
do all you have to sit
yes.
down. Yeah, anything.
And
Yeah.
I didn't know exactly, I knew I had scarring alopecia, but again, I didn't get a lot of information back then. So
Yes.
I'm grateful because the doctor who saw me at that hair restoration company, he was like, let's do a biopsy. Like he really like dive deep into
It
what's
makes me
going
so
on
happy.
before he made the decision. And he was very honest with me. And he was like, after the biopsy, he was like, no, if you get this hair transplant, it's just going to come right back out.
Mhm.
So then that I was like, okay, thank you
That
for
is an
being,
ethical doctor. That is an
yes.
ethical doctor. And I think ethical hair transplant surgeons turn away like half of the patients they see from
Mm-hmm.
a surgery, then Okay, so well, I was trained by Dr. Mark Avram, who is extremely ethical. And the way he trained me, it was just very, very ethical. I feel like he was turning away just as many patients as he was actually performing. And that to me means that he was actually concerned about the patient and not,
Right.
booking surgeries.
Mm-hmm.
And like I said, candidacy for a hair transplant is really, really important, and counseling for that is really, really important. Now, imagine someone has flown 3,000 miles to see you. Are you going to turn them away and tell them, I'm
Right.
glad you're here, sorry, or are you just going to do it because they're
Yeah.
close?
And
You
so
know,
that's what happens with those people overseas and those people who may
a
have
hundred percent.
information.
And how do you do a consult from far away? Like right now, I can see your head, right?
Mm-hmm.
I don't know what type of hair loss you have from over here. You have to get out your trichoscope. You have to do an examination. You have to do a biopsy. You need to feel, touch, look. There's so many like signs. There's things that you have to diagnose. You cannot do it over a screen, right? And unfortunately, that's how the consults are done. Unless someone has had a workup, had a diagnosis, then you can do a consult fine. But this is just not really happening the way it should. Now, I have so many, like I said, international colleagues that are so ethical, and I really, really trust them. But, that's not happening on a grand scale.
Yeah.
Yeah, in
Yeah.
our experiences, yeah.
So when they come to you with the complications or whatnot, what do those complications look like? Is it just the
Okay.
fact that the grafts aren't taking and it's coming back out, or is it more than that?
Um, Everything, like every step of it. So, first of all, candidacy. So some people have active hair loss. So I had a patient who was only 26, and
Mm-hmm.
he was, we call it like mid-stage alopecia. At 26, mid-stage alopecia means that by 40, you wouldn't have a lot of hair. You'd
Okay.
be, as a man, pretty bald, right? So you have, like, ethically, you should stabilize that man's hair loss first so that he's not no longer losing hair, and then do a
Mm-hmm.
hair transplant into areas that did not grow back or are no longer there. So he had a hair transplant into active hair loss, right? So his hair was actively thinning, actively shedding. And so
Mm-hmm.
thankfully, I mean, I don't know what made him come to me, but he came to me several months after his hair transplant, and we were able to save his grafts and stimulate his existing hair. So now he has a full head of hair. You would never know he had even had hair loss.
Oh,
Yeah, so it was good. And then I had
yeah.
a patient that just never should have had a hair transplant. Unfortunately, it's okay, but
Mm-hmm.
completely depleted donor, completely depleted because she didn't have a great donor density in the first place. She had CCCA pretty severe and really bad traction alopecia. So they
Okay.
shaved her whole head. First of all, you know how long it takes to grow your hair back if you should want to. Shaved her whole
Yes.
head, depleted the entire back. So if in the future someday, if we would want to do a hair transplant, could not do another hair transplant. And then
Mm-hmm.
they transplanted it into an area right here and
Mm-hmm.
completely avoided the cosmetically significant area, which was her hairline. So
Okay.
she paid for a hair transplant, had a depleted donor so that she could never get a hair transplant again. And they put it into an area that didn't even make sense because that wasn't the area that is cosmetically significant, which is like a little patch right here. And
Mm-hmm.
avoided the frontal hairline. We've had patients that got what's called atypical mycobacterial infections.
Oh, what is that?
Not good. Um,
Oh, it doesn't sound good. That's why I'm like, what is
Yeah,
that?
pustules and severe infection in the grafts. We had
Okay.
a patient, my colleague Dr. Achama Osetutu that I told you about. She had a
Mm-hmm.
patient develop dissecting cellulitis after Turkey, hair transplant in Turkey, like pus coming out of the scalp, all that.
Ooh.
Yeah, there's just you can name it.
Okay.
The biggest thing is if you have an infection or any kind of complication, who's managing it? You know, you're not
Mm-hmm.
gonna go
Mm-hmm.
back just to have an infection managed.
So just for the audience, you guys have heard Dr. Mina talk about not being a good candidate for hair transplants. And I've said this before
Mhm.
because I just told my story, but I know other women who did get the hair transplant and it did not take, and now they have a scar in the back of their head and they have shaved their head and just have a scar. So just keep that in mind. Make sure you are listening and take her advice, get those consultations, make sure you're a good candidate
Should I
before.
talk about who is a good candidate?
Yeah, go ahead.
Okay. So you have to think about what area you want to cover, right? So if you want to cover your frontal hairline, like your edges, if you want to fill in the middle, you need to have enough hair to cover the recipient area that you desire. That's the number one thing.
Mm-hmm.
So having enough hair could be density, like how many grafts you can get into the area. So how many grafts can we get from the back of your head, or for men, we can take the beard, chest hair, etc. And then you have to think about caliber, right? So like I said, patients with Afro-textured curly hair, we can get away with actually doing very few grafts to cover an area because our hair is so curly it covers, right? And our
Okay.
skin color and our hair color match pretty well, as opposed to someone with very fair skin and very jet black hair,
Mm-hmm.
which, many people have. You actually need more grafts to cover. The straighter the hair, the more grafts you need to cover an area. So those are the things. And then you have to think about the integrity of the recipient area. Is there good blood supply? Is there inflammation? Is there scarring in the area? If you have scarring, it's okay. We can do a hair transplant into scarring alopecia, but your scarring should be your inflammation should be stable. You should
Mm-hmm.
have a biopsy to show that the inflammation is quiescent or inactive. Your hair loss shouldn't be continuing to thin. So like I mentioned, you should not have active hair loss where you're continuing to thin, continuing to shed. So patients like that are great for a hair transplant as long as you have enough grafts to cover the desired area and the
Okay.
recipient area is appropriate, then yeah, you absolutely can do a hair transplant.
Okay. So
Mhm.
so that's something that I guess is a little bit new for me because I've heard it so many times. You have scarring alopecia, you should not get the hair transplants, but you are
Not
saying there is a
yet.
possibility if
Oh
it
yeah.
depends on the stage you're in.
Yeah. So, and then also, so this is the other thing too. Me
Hmm.
and colleagues that I trust, we always do a test before we do a full hair transplant into scarring alopecia. And that just makes it longer and you have to have more patience. So we will do a test grafts of, anywhere from 50 to 200 to 300 grafts in an area, make sure it grows. The wrong thing to do would be to do a full hair transplant, several thousand grafts, many thousand hairs, and they don't
Hmm.
grow back. And that's a finite resource where if you do it and it doesn't grow back, then we've lost those hairs and
Right.
money and time and effort, and it can be more devastating too emotionally. So we always do a test first, but then we have to wait for them to grow, and it takes about 8 or 9 months to see how well they grow. Then if they grow well, then we do the full hair transplant. And so
Okay.
it takes a while. And so I always tell my patients, like, if it's your first time seeing me, if you have CCCA, you've never been treated, you need to give me like 3 years before your hair transplant. I would say 2 years before we can even consider it, and three
Hmm.
years before you'll be happy with the results of the hair transplant, because you need about 18 months to 2 years to treat it anyway first, and then we'll do a test, then we'll do the full hair transplant. So that's a long time mentally.
Hmm.
It's a long time, right? And I can understand some people are just like, oh, we'll do it,
Hmm.
it's booked, but that's inappropriate, and it's not ethical either.
Right. Okay. Okay. Now, can you walk us through the process of how you assess a patient who's experiencing hair loss? What are the initial steps that you take to develop a customized treatment plan for a particular person?
Yes. Okay. First, detailed questionnaire. I go over everything: hairstyling, what you're putting on your hair, how you style it, all that. What systemic issues do you have? Do you have hormonal imbalances? Are you iron deficient, etc.? And then I do a really thorough lab examination, and that's just because if you're seeing me, then you expect me to like be a little bit more thorough. So
Right.
I test for everything, anything that can possibly affect your hair cycle, I'll test for.
Okay.
And then I will look under using trichoscopy to see if I can get clues as to what's causing the hair loss. If
Hmm.
I think I need to do a biopsy to better quantify that and better assess that under the microscope, then we'll do a biopsy. And I would say like 70-80% of the times I'm going to do a biopsy just so I know for sure what's going on. And then
Okay.
it's 2 whole weeks to get all those results back. Then you have to come back and see me. At that time, we'll go over all the results of the histopathology, the biopsy results, and the laboratory evaluation. I will say 80% of the time, there is something I need to adjust systemically that will affect the hair cycle, and that if
Okay.
we optimize the systemic issues, that we get a better final outcome with the hair. And then
Hmm.
after I go over the biopsy results, we'll come up with a treatment plan that's tailored to what we find. And so our treatment protocols are based on what the diagnosis is. And then if it's inflammatory scarring alopecia, I have my pathologist quantify the degree of inflammation, and that helps me tailor how much anti-inflammatory regimen I'm doing versus biostimulatory regimen. And usually I'm doing a combination of medical treatments, like
Mm-hmm.
prescription medication by mouth, scalp-directed therapies, that means topical and, just topical applications and, the procedures that we discuss, and then
Okay.
kind of like nutritional support based on what I find in their laboratory evaluation.
Okay. So
Mhm.
you look at internally as well as
Well, absolutely, because that affects hair cycling.
right, right.
Yes.
Okay.
Mhm.
You know what? I'm just sitting here like, I wish you were around when I
But I was, okay, it's evolved over time because I've
Yes,
had
I
this
know.
long of experience. Now I'm like, well, shoot, gotta add that on, gotta start doing, even like the labs that I drew were like this much. Now it's this much, then it's this much, because I'm
Mhm.
like, oh, that affects the hair cycle. Well, add that, might as well add that on, might as well add that on. And every time I find something, like I said, 80% of the time, could be more, I find something that we can address.
Right. Okay.
Mhm.
Okay. Now, you're also involved in patient education. So,
Yes.
how important is it for patients to understand their hair loss condition, and what resources do you provide to help them with their journey?
So I always, if you're seeing me, you're gonna go home with like a bunch of documents, articles, protocols, everything that we discuss. I have it written out in detail so
Mhm.
that, it's so much information. You're not hearing everything I'm saying. There's no way. And so everything is written down, that part. The
Okay.
Scarring Alopecia Foundation, as you mentioned, is like an incredible resource. The NAAF, the National Alopecia Areata Foundation, is amazing. And then
Mhm.
I try to do a lot of education with our local stylists and do the Strand Network is a network that pairs dermatologists with stylists, things like
Mhm.
that. Those are the resources that I really encourage patients to use. But I try to give my patients articles and resources that if they want to do more research, they can.
Okay.
Mhm.
Now, I know just from looking at your website that you have a stylist, right? Actually
Hmm.
in-house.
Yeah, trichologist.
Okay, so a trichologist. So you kind of like almost cover it all, right?
That's
It's
what I wanted. That's what I wanted for the Skin and Hair Center. So we have me, a medical dermatologist and hair transplant surgeon. I have two PAs that work with me as well, physician assistants
Mhm.
that will see the hair loss patients as well. But I can't do everything. I'm not going to style your hair. We have patients that come with thick debris on their scalp from, the dandruff, seborrheic dermatitis. And so I can only prescribe stuff. I don't have time to be doing actual scalp treatments on people. So
Okay.
I really am enjoying the marriage with having a scalp spa in my clinic with Nia, who is amazing. She's our trichologist. She'll do scalp treatments. She
Mhm.
does our post-op care for our hair transplants. She does styling. She does just like healthy hair care. And so it's been really, really amazing. We wanted to make like a one-stop shop. I also
Mhm.
have hair care products in the office that I recommend. We have a wig shop, so if someone wants like a customized wig,
Mhm.
they can come back and we can make a wig for them. So I try to do all that.
Okay, yeah, that's
Yeah,
perfect. Just to go to one place, you
try
see
to
your
make it like that.
doctor. Yeah.
Yeah, and it just came out of, okay, again, over time, I've been practicing for a while now. It's like, okay, well, this is great, but I can't really help you with this part. Here's, a list of 10 stylists in the city. They're all great. Good luck trying to
Mhm.
transition people off their relaxers. It's just nice because I have patients that I see and they have like really bad debris on their scalps, or they need their braids taken down, or some style that's been in too long. And I say, hey, Nia's right here. Why don't you let her help you with that? You can do it right now.
Mhm.
And so there's no wait. They can just be seen right then and there. So it's been really, really helpful with just transitioning care out of my hands with the things that I do not do. So it's
Right.
really, really nice. And she's amazing.
And I think also it's important because I remember my experience just trying to go to a stylist and being
Oh,
embarrassed because you have a room
100%.
full of people
Yes.
and you have
Yes.
hair
It was
loss
the
and people are
private
looking at
room. The
you.
private room. Yes.
Exactly. So
Uh-huh.
that's like perfect
Yes.
because I
Mhm.
stopped going to a stylist because I'm like, no, that part of the embarrassment part. And then the other part was the last time I went to a stylist, like all of my hair pretty much came out. And I was like, I'm not letting
Yeah.
anybody touch my head again.
I know. And it, like you said, and then everyone's staring, and then people are asking questions, and the stylists are asking questions sometimes if they're not familiar. And then you have to explain the whole thing. And it's nice when they're in a medical setting because they already know what we're dealing with. They have the records and everything. So
Right,
yeah,
right.
it's been
So
a great experience. Yeah.
now, as a seasoned professional in the field, what advancements in hair restoration have excited you and I guess yeah, excited you most recently? And are there any emerging technologies that you believe that are revolutionary in the industry?
Okay, so I think of the last couple years, the JAK inhibitors have been the game changer. Those are the medications that have kind of replaced steroids and other immunosuppressants in our field and have I've really seen the best results for our scarring inflammatory alopecias as well as our autoimmune alopecia, alopecia areata. That's been the big game changer.
Okay.
What excites me are being able to introduce those medications in a different fashion besides taking it by mouth and suppressing the whole immune system just to have like a treatment for the hair. So
Mm-hmm.
newer routes of administering that that's going to be the kind of forefront. And of course, we talked about the bio-regenerative therapies. There's always something new coming out. What is going to be nice, and we talk about it, and it's been spoken about maybe 15 years now. There's been so many advancements, but actual hair um, replication
Mm-hmm.
where what they do is take a biopsy from your scalp,
Mm-hmm.
expand that population on a mouse,
Okay.
remove it from the mouse, and then transplant it back into your hair.
Oh,
So that
really?
people, yeah, so that people that have depleted donors can
Okay.
actually get a hair transplant.
Wow.
That's been studied for a long time. They've been talking about it for a long time, but it's not
Mhm.
commercially available that I'm aware of yet.
Okay.
But something like that, hair replication is going to be where it's at.
Wow. Okay. That's exciting.
Yeah, it is. Mhm.
Okay, so now many listeners, they may be curious about the connection between skin health and hair health. So
Mhm.
can you explain how skin conditions can influence hair loss and
Absolutely.
what patients can do to maintain both?
Well, the main skin condition that can affect hair loss would be psoriasis. So, psoriatic alopecia can occur when you have a really big flare in psoriasis,
Okay.
and that inflammation starts affecting how the hair is growing, and the hair can actually come out from the psoriasis. That is more of a temporary form of hair loss, and so once the psoriasis is managed and the alopecia typically gets better, there's tinea capitis as well. That's when you have fungus on the scalp that can make the hair fall out as well. So that, I mean, it's very treatable. You just need to be diagnosed and have someone actually figure out that's what you have. But that can
Hmm.
cause the hair to fall out. Lupus, you can get lupus of the scalp, scalp skin, and it can
Okay.
cause hair loss as well. Those things,
Hmm.
you would address it the same way you would do cutaneous lupus of the skin as well. And then
Okay.
seborrheic dermatitis, it doesn't really affect hair loss. That
Hmm.
is when you have an overgrowth of a yeast-like organism that gets over colonized, and then your body is trying to figure out what to do with it, and you get redness, itching, inflammation, scaling, and it causes this kind of breakdown of the skin barrier. Well,
Okay.
it's maybe a circular, thinking maybe now it's like a circular thing where you have a breakdown of the skin scalp barrier that makes your skin more irritated. It makes probably you more able to colonize that yeast-like organism,
Okay.
more flaking, and then you get more skin barrier breakdown. But that's more of a scalp health thing, but it doesn't really affect your hair very much. Sometimes if you get any of those things that I just talked about and it's
Hmm.
really, really inflamed, you can get this condition. It's called pityriasis amiantaceae, and you get really thick adherent scale onto your hair and it
Okay.
sticks onto the hair, and that can make the hair come out
Wow.
sometimes. But anyway, that's the answer to the question. I don't know if that's
All right, now you are actively involved in projects beyond your practice, right? So, can
yes.
you share any upcoming initiatives or collaborations
Yeah.
you're working on to bring more awareness to the treatment of hair-related issues?
Yes, well, the biggest one that I'm working very hard on is our a Docs for Hair workshop. That's, like I said, with my colleague, Dr. Achama Ose Chuchu. That's where we are teaching other dermatologists and some other physicians how to perform hair transplant surgery on Afro-textured hair
Okay.
and do all of the bioregenerative therapies that we discussed
Mm-hmm.
on Afro-textured hair. And there's just no other workshop like it. There's no other workshop that's a live workshop like that where we're teaching every single procedure there is, but only on Afro-textured hair. So that's the
Okay.
main thing that I'm working on. Um, as far as like me personally, that project. And then whenever I'm invited to speak for someone or, share my expertise in a community event, I always try to say yes to those things. But that's the personal project that we're working on.
Okay.
And then
Now,
our website. So our Docs for Hair website, that's where patients can go to find hair loss doctors in their communities. You just go to the
okay,
hair loss doctor finder on the website.
so these are doctors nationwide. You can,
And international.
and it's an okay, okay.
Yeah.
So that's a good thing because I hear it all the time. I
And
can't find
Europe,
my dermatologist. So now you
Europe
got
is the
a
worst.
resource.
Yeah, Europe, there's so few uh, dermatologists and physicians that have expertise on Afro-textured hair in particular.
Okay.
So,
All right.
yeah.
Now, earlier you mentioned social media and the influencers,
Yeah,
talking about
yeah,
different products and things
yes.
like that. So, with the rise of social media and like just different online platforms,
Mhm.
how do you see the conversation about hair loss evolving? And what role do you believe healthcare professionals should play in shaping that dialogue?
It's tricky because a lot of times I see practices online that I would love to comment on, but you can get backlash for commenting on something
Yeah.
that you think is an unhealthy hair care practice. For example, we have an epidemic of Black women that unfortunately have hair loss. We've already said that. And
Hmm.
no one wants to look like they have less hair than they wanted, right? So
Hmm.
we're known for our creative styles, right? That's what we're known for. It's what we're the best at. But a
Right.
lot of those styles further worsen the existing hair loss. And so I see a lot of oh my gosh, really creative styles where they're pulling hair into tiny little braids from so
Hmm.
far away to get the hair here, or they're doing the man weaves
Yep.
and
Yep.
then
The
the non
glue and all of the
yeah.
things.
That is great if you never want to wear your hair again, right? Because every time you apply that, you will have less hair over time. Those
Right.
kind of things it's hard to comment on because, you just seem more negative instead of helpful. So I try to just post really positive things. This is me personally, and just maybe helpful things that I'm doing, and try not to kind of be a sounding board like that against what other people are doing. And then maybe people can make the right decisions. But unfortunately, I don't think us physicians are the most sought after people for medical advice.
Okay.
You know,
Okay.
it doesn't seem like it in my opinion, just because
Hmm.
uh, you know, people don't really look for us a lot of times for medical advice as well, because there's a trust issue, and I understand that. I
Yeah.
definitely understand that. And so I think it's our job to do a better job just educating our local communities, each other, and the people who want to listen to us online, versus kind of countering what other people are saying, even though if we know that that advice is probably not the best advice. And I really would encourage your listeners to seek out advice from those who actually treat people with hair loss, right?
Yes. Yes.
So if you are not able to diagnose or treat hair loss, I would not take advice from those individuals, because again, something that works on one person does not work on everybody, right? If you have experience on treating thousands of patients, that's the expertise that you should be seeking out, because a little opinion there, here, opinion there is not really backed by evidence. And
Right.
even if you don't trust like the science, you can trust expertise, right? If
Hmm.
someone is not treating patients with hair loss, I wouldn't necessarily take, hold of that advice as much, because these are anecdotal things. And I can tell you stuff that works on me all day. I
Right.
never encourage you to do it.
So, and to your point, I see those same videos, and every
Yeah,
time I see them, I'm like, oh my gosh, like
I can't say
it's
anything.
not,
I'm not going to
but
be the
it's
person.
hard. Yeah, it's hard because you know that a person just wants their confidence. They just
And I'm like,
want
they look
to feel
great.
good.
They
Yeah,
look
they look really
fantastic. Who
good.
am I to say anything? Just, I hope they never want to wear their hair again. If they don't, do that for the rest of your life. It's amazing. But if you should want to wear your hair again, you have to stop it immediately.
Yeah, yeah, and it's like you said, it looks amazing. I'm always like, oh, that's a cute style, but
Yeah.
ooh, that is not helping you.
Yeah.
But hey, like you said, if you don't want to wear your hair anymore, then it's no big deal to you. You're gonna continue to get those styles, cover it up, and do whatever it is to make you feel good.
Yes, and so Nia, my trichologist or our trichologist at the Skin and Hair Center,
Mm-hmm.
she does do the non-surgical hair restoration where you put the pieces and the units on, but we have the understanding that first the patient has to consent that they're never going to wear the hair ever again. And these are
Right.
people with end stage hair loss that don't want to wear wigs. They want something where the hair looks good for the rest, the couple weeks,
Mm-hmm.
and then it's redone. Just
Mm-hmm.
if that understanding is there, then 100% go for it. But as long as there's education and understanding, I try not to be judgmental at all. Like, some patients will be like, "Oh, you're gonna hate me for doing this." I'm like, "Why would I care? This is your hair."
Right.
Like I'm just giving you advice. You can do whatever you want with it. It's not a big deal.
Mm-hmm.
Honestly, and it's hair. It's not like I'm doing cardiology or
Right.
neuroscience. Here it's hair. So it's okay whatever you do with it. I'm just giving you advice what can make it better versus what could advance your already existing hair loss.
Yes. Okay.
Mhm.
Now, finally, this is our final
Yes.
question here.
Mhm.
So, the audience may be struggling, or maybe someone in the audience may be struggling with hair loss or considering restoration treatments.
Sure.
So, what key advice or words of encouragement would you like to share with someone to empower them through their journey?
So I know it's very, very hard to have hair loss, first of all, and then find someone who will take your hair loss seriously. And so that's why we do have a platform to try to encourage um, your listeners to find a physician, specifically a dermatologist, who does have expertise with hair loss first and foremost. And then
Hmm.
secondarily, you can't be afraid. Well, it's hard. I'm not good at this, but try not to be afraid to speak up when you're getting your hair done
Oh, yeah.
because I have a lot of patients who have obvious hair loss, and I'll say, "Don't you get your hair done like every couple weeks?" They never mentioned that you had hair loss. No, she didn't tell me. Like things like that.
Hmm.
Just advocate for yourselves with your stylist as well to make sure you say, "Hey, my scalp is tender right here. Can you look and tell me if there's something going on?" Something like that. And then when you are seen by someone that specializes in hair loss, just continue to advocate for yourself. Ask as many questions as you can about what it is that you have. What are your odds of getting hair to grow back? What are the expectations of your treatments? How long is it going to take? You know, um, are you going to be a candidate for hair transplant someday? Are you never going to be a hair transplant candidate? How should you wear your hair so that your hair loss doesn't advance? All those things are important. And then try not to if you want to continue to work on preventing your hair from getting worse or more thin,
Hmm.
if you're not getting the answers that make sense to you, don't give up and try to seek advice elsewhere. You don't always have to take the advice of a physician specifically, just because they say it. All of us practice differently, unfortunately. And if something doesn't make sense, there's no problem with getting a second opinion. Like, never worry about that. And also, those of us that really care about you will never have our feelings hurt about you getting a second opinion. That
Oh, yeah.
that's I mean, that is your right, and you never have to apologize about that. I want you to get second, third, fourth opinions because that
Mhm.
means that you're getting input, you're getting information, you're getting more data about what's going on.
And also, I mean, you tell me if this is kind of correct, because I feel like I've seen more people becoming trichologists and like some of the stylists becoming trichologists nowadays, which is good because those are the people who will identify when they see some type of hair loss. So, do
Mhm.
you think there needs to be more of an initiatives for stylists to be educated, maybe in their beauty schools and things like that around?
No,
Um,
100%. I wish that, it's hard. Beauty schools have so much to teach, right? They barely teach about curly hair, so like they need to like, get through that first. And
mhm.
there's not really a lot of education about hair loss, from my understanding, in the cosmetology schools. So getting advanced training is always smart as long as all of us know our scope. So I really enjoy working together with my style, local community stylists, trichologists, etc., so that we're making sure that our patients have the best outcome possible. I think the
Mhm.
issue is when people go out of their scope, right? Like I don't go out of my scope at all. I'm not styling your hair.
Right.
I'm not going to be, I need you to help me make the patient look as good as possible while I'm trying to get her hair to grow back. So we have to work together. But I really, really do appreciate when people get advanced training. It's just that, unless you have a medical license, you can't diagnose or treat hair loss.
Mhm.
And so I think
Right.
when you go outside of that scope, it's inappropriate. It's actually illegal as well because you have to be licensed treat and diagnose hair loss. And I think I don't know why people, well, I know why, but I think there's not an appreciation for how much education it takes to
Mm-hmm.
even become a dermatologist and then someone that treats hair loss. Like you need to go through college, four
Yeah.
years, through medical school, 4 years, maybe a year of research,
Mm-hmm.
internship year, 3 years of dermatology training, another year of fellowship, and then treating hundreds to thousands of patients, right? Or thousands of patients for sure.
Right.
That's a lot of education and then constant continuing medical education. So you have to compare that to, a weekend course or a month-long course,
Right.
to be like respectful of those differences because it's a huge difference,
Yes. Yep. So, okay. Now, I
Yes.
have to mention again Bad Hair Day on
Yes.
TLC.
Mhm.
So we're going to get into that, but first, tell everybody your website where they can find
Sure.
information and all of the things so that if they want to reach out to you, they can book an appointment.
Sure. So my website is skinandhaircenter.com. Very straightforward. And then the hair loss doctor finder is DOCS docs for like the number 4 hair.com, docs4hair.com. Those are the
Okay.
websites.
All
Yes.
right.
And
Thank you.
both of those on Instagram are at Skin and Hair Center or at docs4hair.
Okay, cool.
Yes.
All right,
Mhm.
so you guys got that, and I'll also put it in the show notes or the notes of the podcast. So don't worry if you didn't catch it, it will be in the notes. Now let's get to really quick before we wrap it up. Bad Hair Day on TLC.
Yes.
Now I watched a few clips because I don't have TLC, but
Extreme.
I went on YouTube and I watched what I could watch. And I am like, I like those type of shows. Let me just confess that. Like
Yeah.
Dr. Pimple Popper,
And she's amazing. Yeah,
my
she's amazing.
600-pound life. Like I'm always into it. So when I started watching Bad Hair Day, I was like, oh, wow.
I apologize in advance. Some of it was kind of wild stuff.
You know what? You treated the lady who had the hair on her
Yes.
face.
Yes,
She was
yes,
growing the
yes.
hair. And she
She was
looked
amazing.
amazing
She
when
blew
you
me
got
away.
done with her.
It was like 6 months later, she had written a book. She had a whole relationship. I mean, she had like her life had changed, but her life was off also kind of stifled by the hair on her
Hmm.
face, because she had a full beard, unfortunately. So
Right.
just that was like, oh, heartwarming. Slam dunk.
Yes.
It's like, my gosh, if I die today, I've done something. That was
Uh-huh.
like the best episode. So yeah.
Yes, yes, yes. So everyone out there, if you have not watched Bad Hair Day on TLC, go out there and check it out. I mean, I enjoyed it.
I will say, so I did a hair transplant on there on the first episode, and I
Okay.
can't find that episode anywhere. So we
Yeah,
did
I
a
did.
patient with traction alopecia. She was in the military, and
Okay.
I don't know what happened. It is not on the HBO. It is not on YouTube. I don't know if they took it down. I don't know why, but it was like the best episode because you know how our female military um, I don't know, our military members have
Mm-hmm.
to wear their hair slicked back and they literally have to, and it just
Right.
tears up the frontal hairline. And so we did a hair transplant. It healed amazing. It was like a night and day difference, and it was just and that was our first episode. It was heartwarming, but I cannot find that anywhere. So I don't know who took it down, but that was the best episode in my
Oh
opinion.
man.
Yeah.
Oh, okay. Well, you have other great episodes on there as well. So, and they can go to your website and see all of your testimonials, the pictures, and all of the things. So, you guys go check it out. Thank you so much, Dr. Mina,
Thank
for
you for having
coming on
me.
the Bougie Baldy podcast. Before we wrap up, let me just make sure you guys know out there that the Bougie Baldy show is out, and you need to go to Zandra TV Network and download that app. If you have Roku, Apple TV, or Fire TV, just go to your app store, search for it, download Zandra TV Network, and you will find the Bougie Baldy Show, where you will hear stories from women like myself who have just decided to embrace their baldness, cut their hair off. Well, I should say embrace their hair loss and cut their hair off. And we are sharing real stories, real experiences, and it's a way to help uplift other women out there who are experiencing the same thing, to let you know that you're not alone. And if you do decide to cut your hair off and be bald, you are still beautiful and you need to have that confidence. So make sure you go check that out. And if you are a business that has a product or service that supports women with hair loss, we are looking for sponsors for the show. So make sure you go to my website. It's www.limitlessmindsetcoach.com. You can check out the sponsorship packages. And if you're interested, book a call with me and we will see about you being a sponsor for the Bougie Baldi Show. So that is what we have for today's episode of the Bougie Baldi podcast. Thank you guys for listening, and I will be back with you next week. Bye.
Thank you.
Thank you for listening and watching the Bougie Baldi podcast. I appreciate you as an audience member. Now, make sure you go and check out the Bougie Baldi TV show. You can watch it from any device, any smart device. All you have to do is go to ZandraTV.com and you will be able to pull up my show. It is under the lifestyle section on the menu if you don't see it on the front page. So make sure you go check it out. And if you did not get it, it's ZandraTV.com. Go ahead and click on the link in my show notes if you want to make it easier for yourself, and it'll take you directly there. I will speak to you on the next episode of the Bougie Baldi podcast. Bye.
Thank you for watching the Bougie Baldi podcast. Don't forget to subscribe